and welcome to this month's Lunch and Learn topic. My name is Justin Krueger. I'm a certified financial planner and head of financial planning and one of the owners of Client First. This presentation is part of our monthly Lunch and Learn series. This month we're going to be taking a look at deciphering Medicare, health insurance, and some possible new tax laws. This month I'm going to cover some topics that are always relevant and always important topics when I'm doing planning with clients. So Medicare is, everyone needs it at some point. Health insurance is important. And then I'm going to go over some tax laws that Congress is currently looking at. Let's get started. Quick update on my family. Everyone's back to school. My wife is teaching part-time at Kettle Moraine Lutheran High School. My oldest, Michaela, is in 6th grade. Isaiah's in 3rd grade. Asher's in 1st grade. Our foster son, Chase, is in kindergarten. And then little Zev is 2.5, but he thinks he's 5 years old. So we're all back to school. We had a great summer. So looking forward to the school year. All right, our first topic is Medicare. Let's go over the basics. I do a more intense education when you're turning 65 one-on-one, but this is just meant to give you the basics so you have an idea of what you're looking at and the decisions you have to make. So generally, to be eligible for Medicare, you're going to be age 65, or you could be eligible for Medicare younger than 65 if you have a qualifying disability, or if you have end-stage kidney disease. How do you enroll in Medicare? Now, if you're currently collecting Social Security, you're going to get automatically enrolled. If you're not, you need to actively contact Social Security to enroll in Medicare. Medicare is composed of 2 parts, Part A, which helps with hospital and inpatient care, and Part B, which helps with outpatient care. You can see up in the upper right your red, white, and blue Medicare card. That is your card that gets you access to everything. Your eligibility in most cases is going to be the first of the month you turn 65. So we talked a little about Medicare A and B, which are both government plans. Medicare Supplements are not offered by the government. They are from private insurance companies. They help pay some of the costs that Part A and Part B did not pay. You can see some of the things on the right side of the slide that they're going to cover. So how do they work? How much do they cost? Generally, they're going to cost about $150 per month, maybe a little bit less for women, a little bit more for men the first year, and then premiums are going to go up every year after that. The enrollment rules, during that initial open enrollment period when you turn 65, you can see that it's the month you turn 65, and then that month and the following 5 months, for a total of 6 months, you're going to have no health questions. So it's guaranteed enrollment, as well as if you're losing coverage such as employer coverage, COBRA coverage, you'd also have a guaranteed enrollment at that time also. If you would want to switch from one supplement to another later, there would be health questions at that time. So again, we covered the important date, the open enrollment, initial enrollment period for Medicare Supplements is the month you turn 65 and the 5 months after. Medicare Part D plans, this is prescription drug coverage, not drugs that you receive at the doctor like chemotherapy. These are drugs you pick up at the pharmacy. So these are drugs not covered under Part A or Part B. Part D plans are offered by private insurance companies, and they have monthly premiums between $20 and $150. The average plans are $30 to $50. These are going to help pay for medications. They're going to be based off a formulary, but the formularies may be different. A formulary is just a list of covered drugs. And then the important dates to remember are going to be very similar to Medicare Advantage, so I'll cover those in some future slides. So formulary, list of drugs that it's covered, then you're going to have tiers of prescriptions here. So tier 1, you can see on the right hand of the slide, so tier 1 generics might be $5 a month, tier 2 might be $10, tier 3 brand name drugs might be $40, tier 4 brand names might be $80 a month. Medicare Advantage plans. These plans look and act similar to a lot of your coverage when you're working. They are going to combine Part A and Part B coverage, and most also combine Part D prescription drug coverage. You do not use your red, white, and blue card when you're under Medicare Advantage. Medicare has subcontracted your benefits out to the Advantage plan company. Important enrollment dates for Medicare Advantage plans. Your initial enrollment period is the 3 months before the month of you turn 65 and the 3 months after. You can see the chart on the right there. So a 7-month period. So that period you can initially enroll in Medicare and a Medicare Advantage plan. And then the other most important date period is the annual enrollment period. This happens every year, October 15th to December 7th. You can switch Advantage plans at that time. No health questions asked. So you're free to shop plans, change at that time. Some common other enrollment periods for Medicare Advantage: special enrollment period. So if you are moving out of the service area, or if you're losing health insurance coverage such as employer or COBRA coverage, you have 2 months to change your coverage during this special election period. As well as if you're working past 65, you have the special election period to pick up Part A and Part B. There's actually an 8-month period. However, you can see below that the 8-month period is for Part A and Part B, but the Part C and Part D enrollment period, again, is 2 months. So for practical purposes, if you are losing coverage, moving, etc., if you have one of these special periods that apply to you, essentially you have 2 months. So I wouldn't focus on the 8 months. 2 months is basically what you're restricted to. Here are some enrollment periods that are not often used: the general enrollment period and the open enrollment period for Medicare Advantage. This is if, in theory, you're switching back to a supplement, doing some different specialized things that don't happen very often. But they are out there, but they're very rarely used. At this time, I took questions from the audience. I'll just kind of cover some of the most common questions that are brought up. People asked, which plans are better. Supplements and Advantage plans are both good. You have to make a decision. Either you're going to do a supplement and a separate Part D plan, which is going to cost you about $2,000 per year, whether you go to the doctor not at all or 100 times. Or you can do a Medicare Advantage plans. Most of the competitive ones are $0 per month. Most people have been choosing the Medicare Advantage plan when I give them the options, because they'd rather keep their monthly premiums in their pocket and use those for co-pays. It is important to remember that regardless of which plan you choose, you need to pay the Medicare Part B premium regardless. That currently is $135.50 per month. They will charge that directly out of your Social Security if you're collecting Social Security. If you're not collecting Social Security, you have to pay that as a quarterly bill. The other frequently asked questions on Medicare plans is, can you switch between Medicare Supplements and Medicare Advantage plans? The answer is yes, maybe, maybe not. So you can always switch from Advantage plan to Advantage plan every year. You can always drop a supplement at the end of the year and pick up an Advantage plan. What you may not be able to do is drop an Advantage plan and go to a supplement, because a supplement, past that open enrollment period, they can ask health questions. So they could say, no, we're not going to cover you. This is important to know up front. In practicality, I don't have that many people actually do it. What I recommend people do is stick with one strategy, advantage or supplement, and stick with it for the long term. If you try to jump back and forth, you're probably going to get burned. Health insurance coverage. So now we're talking about health insurance coverage prior to age 65, which I call underage insurance. For young people, you generally think of underagers as people under 21, can't go to the bar. So I refer to people under 65, not on Medicare, as underagers. So we have individual coverage we'll go through, marketplace individual coverage, and Christian share and ministry plans. So individual health insurance coverage, this is individual coverage you purchase on your own. It's typically more expensive than your group coverage or your COBRA because they have to take everyone. And it can be purchased through the Affordable Care Act, which we'll cover on future slides. You can purchase it through a broker or directly with the insurance company. I recommend you use an agent or broker because you're not getting any discount for going directly. Whether you use our company or another firm, they're going to provide you some knowledge and assistance. There is tax subsidies potentially available, and we'll talk about that next. So the Affordable Care Act, you have access potentially to tax credits. The magic number for couples is if your gross income is below $65,000. As a couple, married couple, you may be eligible for a tax subsidy. They have looked to change the Affordable Care Act. However, they have not done anything to date. So all of those tax subsidies are still in place. So I look at those and say, well, they haven't made any changes. If they made a change right now, which they're currently not working on anything, then it probably wouldn't take effect until the earliest of 2021. So I'm planning for these kind of 1 year at a time with folks. Important to note that I have several clients on marketplace coverage where couples get $10,000 or more of health insurance tax subsidy on their tax return to help pay for the coverage. So you're looking at your premium might have been $2,000 as a couple, and with the tax subsidy, it's only $200 a month. So huge potential savings. Important dates to remember for this. Open enrollment each year is from November 1st to December 15th. This is when you can change plans effective for January 1st. Again, no health questions. And then special enrollment periods. If you're losing health coverage, like from an employer, you're moving, you're getting married, having a baby, adopting a child, you have 60 days from that qualifying event to enact coverage at that time. And it's guaranteed issue, they have to take you at that time. Christian share and ministries plans. This is an important alternative out there. These are offered by organizations where people are sharing medical bills. They simply facilitate sharing expenses between individuals and many times Christian groups. Most times it's less expensive than traditional health insurance by quite a bit. It is important to note this is not actually insurance, it's just people acting on good faith. And they are exempt from the Affordable Care Act. My family is actually on one of these plans. It costs about 1/5 the plan of insurance for myself, and there's about 5 large share plans out there that have been sharing bills for 25, 30 years. The one I'm under They've shared like 3.4 billion in bills over the year. So a little bit of stats: over 1 million Americans participate and share more than 600 million in medical bills each year. Most of them have a 3-year wait for pre-existing conditions. However, some of them will have extra funds if you do have something pre-existing. So again, the profile here: if you're healthy, they're a good choice. If you have substantial pre-existing conditions, they may not be a good choice for you. And then they do have lifestyle restrictions. Many of them will say you can drink alcohol, biblically, use tobacco biblically, such as 1 or 2 cigars a year. So they can deny claims if they connect an illness to drinking in excess, drunk driving, heavy tobacco use, things like that. So if you're not using some of those substances in a responsible manner, Christian share probably wouldn't work very well for you. Health insurance, I'll cover a couple of the common questions. Affordable Care Act, again, no changes there. Christian share is a good alternative. In most cases, you have 60 days to pick a plan when you're leaving, retiring, etc. Another thing I like to consider is make sure we consider your COBRA options if you're retiring, and make sure we're looking at all the options when you're looking at under 65, underage options for you. So a quick review of the Tax Cuts and Jobs Act that was passed a couple of years ago. This is one of the largest tax cuts ever. So here's a summary of it. Most people reduced their tax bracket by 3 or 4%. So example, 15% went down to 12%. 25% went down to 22%. It doubled standard deductions. It limited state, local, and property taxes to $10,000 as an itemized deduction. It eliminated miscellaneous itemized deductions subject to 2% AGI. It eliminated the personal exemptions. However, it added and enhanced the child tax credit. So it enhanced it from $1,000 to $2,000 per child and increased the income limits for eligibility. It also added the $500 dependent credit, which basically took the place of the personal exemption in most cases. It also increased AMT exemptions, which means less people are subject to AMT, the alternative minimum tax. And then many of your small businesses, pass-through entities, had this 20% tax deduction, which was a great benefit. It also eliminated the health insurance mandate and penalties associated with that. As a reminder, this tax law is set to sunset at the end of 2025. If they do not do anything, the laws will simply revert back. So you have a window of opportunity here where we know taxes are going to be lower for sure. Questions on this tax law? Some common planning I've been doing with people related to this. Many of my young people that are working that have children, due to the larger child tax credit, lower tax brackets, we've been shifting more retirement money to Roth IRAs. And then I have people that are retired that we're doing large blocks of Roth IRA conversions because we're in this such a low tax environment for the next several years. As well as All right, moving on. So I wanted to spend quite a bit of time on tax laws that are out there as possible upcoming changes. So right now we have the Secure Act working its way through the House of Representatives. So this stands for Setting Every Community Up for Retirement Enhancement. Again, this is in the House of Representatives. It is not a law. As well as in the Senate, there is RESA, which stands for, let me look up what it stands for again. Retirement Enhancement and Savings Act of 2019. So that's working its way through the Senate. They have very similar provisions, so I'm going to go through the highlights of the Secure Act. Again, I apologize for this being so wordy. I just copied and pasted. I'm going to go through each slide and just summarize what's important potentially for you as a retiree or someone who's working. So assuming they pass the law, I will summarize these for a future presentation and eliminate all these extra words. So we have sections. I'll just break it down by section. So section 101, we have an expansion of the cap for safe harbor 401k contributions for auto enrollment. That's good for people who are working in retirement plans. Section 102, what this does is this allows more flexibility for large 401k plans. If you ever work for a large employer and the employer's 401k plan failed their what's called top-heavy test and you were required to take money back out of the 401k after the year was over, which is not a fun thing after you've saved money and you're told you can't have this in your 401k. Section 102 would basically allow them to amend the plan, say in January or February, after the year is over, and they could do some safe harbor contributions for the lower compensated people at the company, which would then allow for the plan to be compliant and everyone to have more retirement savings. Section 102 is providing some tax credits for employers who start up 401k and retirement plans. So you can see $250 or $500 there depending on how many participants, up to a maximum of $5,000. And they could get this credit for up to 3 years. So again, this has to do with startup costs of a 401k or retirement plan. Section 104, another credit of $500 per year to employers who are going to set up automatic enrollments for their simple IRA and 401k plans. Section 105 I have highlighted. So this is cool if you're a graduate student of some type and your income does not qualify as income for IRA contribution purposes. This would allow you to use that income IRA for IRA income contribution purposes. So again, encouraging people to save when they're young. Section 106, this is on the other end of the spectrum. This would allow people to contribute to a traditional IRA if they're still working past age 70 and a half. So if you're still working and you still want to save money, that's great. Section 104, this is just encouraging people not to use their plan as a credit card with 401k loans, so that's good. Section 108, 109, and Section 110, these are very specific administrative rules. I'm not going to spend any time on those. You could read through them, but they're very specific to a couple problemsome administrative rules. Section 111 requires employers to basically open up contributions to more part-time workers. On the back end, it allows the employer some forgiveness on the top-heavy compliance rules for these small people if they're not contributing. Section 112 with penalty-free withdrawals from plans for qualified birth or adoptions. I think that's great. Section 113 I have highlighted. This is one of the major things from the bill that's been talked about. So this would potentially, for traditional IRAs, raising the required minimum distribution starting age from 70 and a half to 72. So this is potentially the largest part of this bill. Section 114 and Section 115, again, these are very specialized. I'm not going to spend any time on these. You can read through them if you want. Section 201 and 202 I have highlighted. So 201, how this would work. This would allow, let's say you have an employer that's been wanting to start up a 401k plan, but they've been busy working at what they've been doing well. Right now, you have to set up a 401k plan before the end of the year. This provision would allow them, say in January, to set up a plan for the prior year, make contributions to it for their employers, and get that plan started. So I think this is great. Gives employers more time at the end of the year to set up a plan for the prior year. Section 202, very impactful too. This would basically allow several small employers to pool together into one larger like group 401k plan. So this would allow them to spread their administrative costs across these several smaller employers and save costs and provide more opportunities for these smaller businesses. This is, again, a very potential large impactful part of this bill. Section 203 and 204 I have highlighted. Section 203, this is would be requiring them to list annuity payment options on 401k statements. This is just making people more aware that they could take their payment more like a pension. So I think it's good just giving people more information on their 401k statement. Section 204. And then this is if someone does opt in for some type of annuity or pension payment instead of a lump sum payment. This takes the employer out of liability for those payments. Section 205, just a protection there. That's a very specific one as well. I'm not going to spend any time on 205. Section 301 and is very specific. Section 302 I've highlighted. This would allow 529 plan balances to be used for homeschooling, apprenticeships, and student loans. I think this is great. Gives you more flexibility if you put money in a 529 plan, but then you decided maybe you want to homeschool your kids or they want to do an apprenticeship. In the past, they've discriminated towards post-secondary education. Recently, they opened up 529 plans to high school, but this just expands the options even more. Section 401. This is another one of the most impactful possible provisions in this law. So this would change the required minimum distribution stretch option. So some of you may be familiar with, if I have an IRA, I leave it to my son, he can then stretch that IRA over his life expectancy. This 401 would restrict that to a, basically if you are more than 10 years younger, if you're a non-spouse beneficiary and you're more than 10 years younger, you would have to take out all that money over 10 years. I can see why the government is putting this in, because they want that tax money. My retirement account is not intended to be stretched out for my son's retirement, so I can see why they're doing it. I like it the way it is for people. It gives ultimate flexibility, but I can see why they're doing it. If they do something like this with 10-year provision, that's reasonable. It gives some time to stretch out those distributions. So I think that's reasonable. If they took the stretch option totally away, that would be not good, because the people would be required within 5 years to take out all the money, and you wouldn't really have any tax planning flexibility. So this is very important to see what happens with this section. Section 402, just some increased penalties if a plan fails to file, or no, this is for individuals if they fail to file taxes. Section 403 and 404, these are just added fees and penalties for plans if they fail to file for 403, and 404 is a very specialized thing, not really related to plans. All right, so most impactful things, I'll just summarize again. There's a bill in the Senate right now. I went briefly through the bill that's in the House of Representatives right now. So they're both working on bringing these bills together. So it's important to watch these developments. If they pass this, we'll do a presentation and give a summary of the changes and how it's going to impact you. But the potential things are change of the 401 or the required minimum distribution rules, potentially raising that from age 70 and a half to 72, restricting stretch provisions to a 10-year distribution for people that are 10 years or younger. And then also providing more opportunities for small businesses to set up 401ks, whether that be through tax credits, setting up a group 401k with other employers. That's a potential here, as well as allowing people to contribute to their traditional IRA past age 70. And on the 401k, potentially letting employers set up a 401k after the calendar year is done. So there are several things in here that are positive. I think the only negative one here is if they do restrict the stretch provision, especially if they would restrict it to something, if they would eliminate it at all or go less than 10 years, that would be definitely negative impact. So we'll keep, as this develops with the two bills, the one in the House and the one in the Senate, we'll keep you updated here at Klein First and let you know as soon as something is law, and then how it could potentially affect you in retirement, before retirement, or as part of your overall tax plan. As a reminder, this is part of our monthly Lunch and Learn series. Next month we have Quarterly Markets Insights. That'll be David Zarling presenting. That's on October 16th. That's offered at noon and 6:30 p.m. at the Columbian in West Bend. I just covered that. So again, Dave will be presenting noon and 6:30 p.m. He'll be covering adaptive and what's been going on in the markets the last quarter. And then a reminder, some of our new team members, Kylie, it will be graduating from UW-Whitewater this December. She's been working for us part-time 2 years, and she'll be joining our financial planning team. Ian is a CMT, a chartered market technician, same as Dave. He's supporting Dave on the investment management side with Adaptive. He actually lives in Virginia. And Donnie has a strong background in banking, and he is joining me on the financial planning team as well. So we've been happy to be blessed with growth, with more clients, and we're adding to our support team to help support those clients going into the future. If you're not a client and you want to learn more about our true holistic planning process or anything else, need help with Medicare, insurance, estate planning, Social Security planning, etc., you can call our office 262-335-1700. If you're not a client and you want to do the initial no-fee consultation, you sit down with me or one of our other advisors for about an hour to an hour and a half, depending on how many questions you have. There's no fee for that. We're not a high-pressure firm. That's just an opportunity for you to ask questions about our firm and about our planning process, and then it's an opportunity for me to assess what type of planning you might need to do, and then I'd let you know what type of costs there are associated with that. So the door is open there. Let us know if you have any questions or if we can help you in any way.